What's going on, man?
How you doing?
Doing well, I can't complain. So it's Dr. Shiven.
Hey.
My buddy and friend, and we're here to make things happen.
We are.
How's your week?
Good. How's yours?
I can't complain. It's all good. Yeah, everything's going well. What do we got going on today, man?
Well, what are we talking about here?
Well, the concept that healthcare has not really changed very much over the past 50 years, and yet everything else has changed around us. Transportation, the way we deliver, everything from food to you name it. But healthcare, we're still kind of in the dark ages. Here we are sitting, doing things the same way we did them, say, 20 years ago. If you were a doctor 50 years ago, which I wasn't in that era at all, you're still kind of doing things the same way.
Yeah, it's a little disappointing.
It is disappointing. It's disappointing. But out of the ashes of that, comes a new revolution and a new kind of clinician that says, enough is enough. I'm going to take care of my patients, and I am going to make sure that when my patients come in, not only do they understand what's wrong with them, but they walk away with the sense that, this guy listened to me.
It's a partnership approach.
It's a partnership approach. Now, by the way, Dr. Shiven is an integrative medicine physician, which, by the way, just real quickly, what do you do?
Sure. I know, I get that question a lot. So we combine Western and holistic methods to help people feel better. That's the nice summation of it.
Yeah. And I like that because, in my practice, a lot of times patients will come in and they have, I don't know, maybe 4 or 5 different problems. Mm-hmm. I might be able to take care of 2 of those.
Right.
But the other problems, I am not equipped to take care of them, mm-hmm. or I don't know who can take care of them.
Yeah.
So I think it is so important to have somebody like you that we can send to and say, hey, I know you need somebody that can look at this from a wider perspective. And my understanding as well is that you spend more time with your patients than, say, a person walking into a normal doctor's office, right?
Yeah, because, believe it or not, finding the root cause takes time.
It's amazing you say that. And healthcare is so complex, and yet it's I think 5.2 minutes is what we're spending with our patients now, which is really amazing to think. It's actually amazing that people feel as good as they do because we spend so little time with them. It should be worse than it actually really is.
Absolutely. I think before understanding someone's pathology, you need to understand the person.
Right. And I think that's the part where I've really probably appreciated that more as a physical therapist because mm-hmm. I am forced to be with my patients for a long period of time. Usually a session is 30 minutes or an hour or whatever. And in those 30 minutes to an hour, I find out more things that may be an underlying cause that wouldn't be so evident in their chart. Mm-hmm. The fact that they had transportation problems to get to my clinic mm-hmm. is more of a social issue that if that was resolved, that might, I don't know, help them get to the grocery store and buy fresh greens and whatever fruits as opposed to just going in and getting whatever the freezer stuff and, microwave stuff. So
I know, and that's why if the basic needs are not met, you can't move on to the higher specialization that we've been doing in the United States, Right. We have for every organ that you have, we have a specialist for it.
It's pretty amazing, isn't it? It's pretty amazing. Yeah, no, it's interesting because when I lived in Zimbabwe, which is what the political term now is the developing world. Mm-hmm. They used to call them third world countries. Sure. we've since gotten better and more politically correct. But I think out there in the developing world, the issue is that we don't have enough healthcare providers. We don't have all the tools, the fancy tools that we have in this country. I think I was talking to a psychiatrist in Zimbabwe who said there are only 5 psychiatrists in the entire country, which is really amazing to think about. But, my point there was we didn't have as much of the stuff that we have here to diagnose and treat and all the specialists. And then moving to the States, I found a system that was broken in a different way. We have all the tools, but people just tend to be really, really, really sick. And you go, well, what's the problem? And everybody always goes to the low-hanging fruit, which is, we need more healthcare providers. What's your take on that? Is it we need more healthcare providers, or there's something deeper than that?
I think there's something deeper than for sure. I think we certainly can argue that there is a need for healthcare providers, but I think when I am seeing a patient and I find a patient challenging because I can't diagnose them, I go back to three things. And these are basic things that I think every doctor should be looking at. You look at physical movement, you look at nutrition, and you look at mind-body medicine. And you will find the answer there, right? Because we know that our environment is playing a big role. And we also know that the prevalence of chronic health conditions, especially, I should say, this developed country, it's getting worse and worse.
Right.
Our health's getting worse. So whenever I am assessing anybody, it doesn't matter if you have cancer, autoimmune disorders, cardiovascular, neurological, it does not matter. You go back to those three foundational things and you kind of understand what is happening with the patients.
Right. That's amazing. So you know that, and you obviously physical movement is my bread and butter, and I it's I get excited when I hear physical movement. But you know what's really also interesting to me is I don't know if this is even statistically has been proven or not, but I have always imagined, especially when I worked in the hospital system, I've always imagined that most of the problems that patients end up coming into the hospital with, especially the chronic problems, can be traced back to food. What are your comments on that?
No, I think that's so absolutely right. That's just the bottom line, right? I think a lot of what we see nowadays, right, the conditions that we are treating, like for example, heart attacks and diabetes and obesity, well, these weren't around for that long.
Right.
These were
Very
not
true.
things that physicians that are older will tell you. They did not treat these conditions as much as we do now.
Right.
And it's not that in the past 50, 60 years our genetic pool has changed. That's not enough time for genes to change.
Right. Exactly.
Right? So we ought to look at what's going on in the environment, and we are what we eat. We are what we eat. So ultimately, I think nutrition is one of the big components, and tracing back things to food and what we're eating and putting inside our body is the number one thing that we do in integrative medicine.
No, that's awesome. So, for those of you who are watching this, one of the cool things about Dr. Shiven that I say he's the only physician I know who actually can cook a meal for a diagnosis. And he's done wonderful work. For those of you who follow him on Instagram, and I would suggest you do if you can. He's really an avid cook with really health in mind, which is something that patients don't really. I mean, people are intimidated by cooking. First of all, I think people look at ingredients and they go, "Oh my gosh, what do I do with all this stuff?" But I would argue, and I'm not a cook by any means, but I would argue if you have the right ingredients, however you put them together, if that stuff ends up in your belly, it's good for you. But if you can arrange it even better, it might taste even better, and then you've got something really good. But on the other hand, if you go the other direction where the ingredients are bad or the ingredients are not healthy for you, that stuff ends up in your body and it ends up causing disease at some point. You're the chef doctor, as I say. But I think it's such a great combination, because one of the things that I always hear from my patients is they will say, my doctors say, diet and exercise is what you need. Right. But that's as far as the conversation went. They didn't get any further instructions. And it sounds to me like you kind of close that loop.
We do. First of all, thank you so much for the kind words. I don't know if I consider myself a chef, but I do consider something, which I think I tell to all my patients, that anyone can cook. You don't have to be a chef to make good food and use food as medicine. I actually didn't cook for the longest time. When I was in training, we didn't have much time. And I think that's one of the reasons that a lot of people will quote, "Oh, I don't have time." But I would argue you take time out for important things. And that realization is what changed my life and really treating food as medicine. Now, we are not doing the best job in treating food as medicine. I think that is a problem with the processed foods that we get out in the grocery stores. But there's a higher issue here, a bigger issue here, I would say, and it's at the legislative level, right? Because right now, if you look at what the food industry is doing, right? Well, we have focus groups on how much Cheetos dust is the right lickable amount, right?
The colors, the texture, and how much it puffs in the air.
Exactly. So we're fighting against that, and the thing is, these are also such subliminal messages that are being spread across throughout the country, where it's difficult for a consumer to pick the right product.
Right.
Well, how do you change that now is the question, right? Well, number one, we have to argue at the legislative level, right? If we are subsidizing corn for the farmers because we need to make high fructose corn syrup, well, that's a problem. Maybe we ought to be subsidizing more fresh fruits and vegetables.
Correct.
Now let's go from the legislative level to an individual level, because that, I think a lot of us need to come forth and get that problem fixed. But what do you do right now today as an individual? I say the number one thing is to read food labels, right? And that should be taught actually at school level. Right. And there's so much information that you can gather just by reading where your product is coming from, what ingredients it has, does it have additives, preservatives, and all those things. And I think that basic level of training we need to get right away.
Yeah. And that's interesting that you say that, because we did the same thing with smoking many years ago, didn't we? Where we I think somebody was saying to me, there was a time when we used to prescribe smoking for relaxation, because you're stressed out, pick up smoking but then we found out smoking was really bad for you. They had no benefits whatsoever, and over time we have really made the education piece of it that if a person picks up a cigarette, they are not void of the information and the risk that they're taking.
Sure.
And that really has changed the habits on those who smoke. But in addition to that, really taking a lot of money in taxes to educate more young people to not pick up smoking, and help those who are smoking, who are trying to stop smoking, do it with greater ease. But I see a mismatch when it comes to food, because really, like, we come back to that same problem, right? Which is when you look at the problems that most people come up with in the hospital that are chronic, whether it's diabetes, obesity, and all those come together almost as a flood, and it takes maybe 15 to 20 years for them to become such a catastrophe that they just end up killing the person. We're not looking back like we did with smoking, where we said, hey, smoking is not going to kill you when you smoke one cigarette. It's over a period of time that your arteries are going to harden, your lungs are not going to be exchanging air as efficiently as they should. And when the time comes, in addition to cancer and all the other things that could happen to you, you could die very quickly or die slowly over a long period of time. And I think we need to treat food the same way, like you're saying, from a legislative standpoint, when we say certain foods are poisons. It's the equivalent of taking lead and putting it in our water and saying, oh, drink that. It's not going to kill you right away, but over time it's going to cause some problems. So that's really interesting to that we're not, but I like the legislative point. So if you're legislating,
the same thing that you say about smoking, we actually see in the food industry and what's happening, right? Because there's a lot of additives and preservatives. Quite frankly, we don't know how safe these are, right? One simple example is trans fats. It took us many, many years before the FDA decided that trans fats are no good. Why were we placing trans fats in our food supply? Well, we're trying to increase shelf life. And I would argue, and a lot of scientists would argue, that it was quite apparent from the get-go that trans fats should not be added to the food chain. But it takes heaps of evidence, right? Because what the standard is when you're adding a new preservative additives, there's a list that is regarded as, these are called GRAS, generally regarded as safe. It is questionable with some of those ingredients, though, when you're adding them as a preservatives. Are they truly safe or not? Our ancestors used to use preservatives, but they were natural and in a different form. So things like citrus and salt. Now we have replaced these with things like FDNC yellow number 7, which is a completely synthetic color that does not exist out in nature.
That's amazing that we have, we've the pendulum has swung so far to the other end that now what we eat is actually starting to harm us.
Yeah.
And I think a fundamental right, if we had to look at it that way, is to be able to trust that the food that you eat is safe. It's almost like water, right?
It is.
Being able to know that the water that you put in your mouth when you drink, going through the city pipes, is safe for you to drink and not kill you. But I think food has become kind of this thing where we're literally playing Russian roulette with our lives when you eat certain foods for a prolonged period of time. So in your experience, what foods do you think are the worst offenders? The things that people are that they're taking and you go, oh my gosh, that's just a bad idea.
So here's one simple advice. Always stay out in the peripheries of the grocery store where the fresh produce is, right? When you venture out in those middle aisles with the frozen food and the refrigerated section, right, with the packaging, you know that it's coming out of a package, right? So you know there's some level of additives that we have placed inside of it. And that's for a number of reasons, right? But whether it's to make the food tastier or whether it's to increase the shelf life. But the best advice that I could give you, if you peruse the grocery store, just stick around the peripheries where the produce section is.
I like that. So that's the advice from Dr. Shiven. Stick to the periphery. Try not to venture too far in the middle. That's the tasty stuff that your taste buds are probably used to. I've been a vegetarian for a number of years now, and my advice is that there's a new normal for everything that you start. It takes about 3 months, at least in my experience, for you to start a new habit. And whether it's exercise, eating something new, you find that after 3 months, that becomes normal for you. I don't crave the foods I used to eat before, and and that's okay. I don't condone everybody to become vegetarian because it's not for everyone. Meat is not necessarily bad. Just that's for another subject for another day. But being able to acclimatize your palate to fruits and vegetables might take a little bit of time, but over time it just becomes normal.
Absolutely.
The same way I haven't drank pop in 25 years, and quite frankly, the few times that I've tried it, I've almost had a headache, like almost instantly. But I used to drink, my favorite poison of choice was Dr. Pepper. I would go through a case like in 3 days. And the day I stopped was the day I stopped. So be encouraged. I think this stuff will work. And if you take the advice of people that are in the industry that are seeing people 10, 15 years after they started a bad habit, like drinking a lot of sugary drinks or extra preservative in their foods, you might prevent that same event from happening in your life. But the time to start would be now. And
I just want to add one additional thing to that. I think it's absolutely right that we are not taking enough fruits and vegetables in our diet. And these are some sobering statistics that I want to share, that when you look at the United States as a whole, we have 1 in 10 people that are taking the recommended daily allowance of fruit and vegetable. That is 10% of the population. That is not very many. And we have an abundance of research now that actually talks about how fruits and vegetables are better to prevent chronic health conditions.
And
these
makes
are
sense.
Big population-based data that we're talking about.
It makes sense. No, I notice that every time I dip into foods that I shouldn't be eating, I don't feel really good, and quite honestly, the pleasure is so short-lived. And the consequences are so long-lived that it's almost like for the 3 seconds that I tasted that, I have to pay this much for it. It kind of doesn't make sense, but I know it's easier said than done. I know, but with the help of folks like Dr. Shiven, I think you can really get into a habit of eating the things that are right. And of course, if you really want a professional like him to help you out, go to hutano.com, or you can go to drshiven.com, book an appointment, and come see this man. He's really good at what he does.
Thank you so much.
Appreciate it, my friend.
Of course.
All right, take care.